Hi, this is Amr Abdigawad. I'm going to discuss in this lecture the Ortolani test. So what are the objectives of this lecture? We'd like to describe the appropriate method of performing the Ortolani test, and we're going to show a video for a positive result for Ortolani test. A good source that you can use to read more about Ortolani and Barlow's test and DDH is this book, which is Pediatric Orthopedics Handbook for Primary Care Physicians, written by myself and Dr. Naga. Also, I encourage you to see the video for the DDH explaining everything in this condition and the other video for the Barlow's test. So what is the idea of the Ortolani test? So the Ortolani test is done to assess if the hip is dislocated or not. So this is the correct way of performing the Ortolani. So the examiner holds the leg, the infant's knee is in the examiner palm, the examiner thumb is on the medial aspect, the four fingers are on the lateral aspect, and then both feet are held together, but the exam is done one leg at a time. So the examiner is holding now the patient's left leg, and he's going to do the exam. So it's two maneuvers. The first one is abduction, which means that you're bringing the leg outward, and then the second maneuver is an anteriorly directed force from these four fingers. So it is two movement in the same time. The first movement is abduction, which means bringing the leg outward, and then the other movement is anteriorly directed force from these four fingers to assess if you can relocate the hip or not. So the examiner holds both leg. The exam is done one leg at a time. Two maneuvers, abduction and anteriorly directed force. The idea is to see if you can relocate the dislocated hip or not. Positive result is a clunk. It means that you feel that the hip is going out from out of the hip to in the acetabulum. So positive result is a clunk and not click, because a click is a normal finding. The positive result is you will feel that the hip is going from outside the acetabulum to inside the acetabulum. This picture shows us the difference between the Barlow and the Ortolani test. Remember, the Barlow test is you'd like to see if the head is subluxable or not. What does this mean? You'd like to see if you can dislocate a subluxable head. So the Barlow maneuver is you're actually a reverse of the Ortolani. So you're adducting, which means that you're bringing the leg inward, and then you're pushing posteriorly with your whole palm to see if you feel that the head is coming out, the head of the femur is coming out of the acetabulum or not. Ortolani is the reverse. Ortolani, you'd like to see if the hip is dislocated or not. So you're starting with a dislocated head, and then you're going to do, as we said, two maneuvers. Abduction, and then you push with the four fingers. You're pushing the head of the femur anteriorly to see if you can relocate the hip or not. So again, with the Barlow maneuver, you're starting with the hip in, and you'd like to see if you can get it out of the hip or not. So you'd like to see if the hip is subluxable or not. In the Ortolani, on the other hand, you're starting with the hip dislocated, and you'd like to see if you can relocate the hip. In both of these, the positive result is a clunk and not click, which is the feeling of the hip going out and in of the joint. So again, last time Ortolani, you starting with the hip dislocated out of the joint, you abduct, push the femur anteriorly with the four fingers to see if you can relocate the dislocated head. So we'll present this video now that shows a positive result with or the Ortolani test. If you see, I'm holding here the both sides, but we do the exam in one side only at a time. So the infant's knee is in my palm. The thumb is on the medial aspect, the four fingers are on the lateral aspect, and you do two maneuvers. You abduct, means that you bring the leg outward, and with the other fingers you push the trochanter and the whole hip to the anterior direction from the lateral side. So here, see, I'm abducting, and with this finger I'm pushing the leg anteriorly, and if you see, when we do that, you can see obviously that the hip goes into position. Let's repeat that part again. Here it is. I'm holding it, abducting, pushing with these fingers, and you see that the hip went inside the joint now. The head of the femur went inside the acetabulum, and you can see this when this happens. Usually the result is not that obvious. The positive result is a clunk, that you feel the clunk. Clunk means that you feel the head of the femur going inside the acetabulum. In most of the cases not that obvious, but the positive result is a clunk, not a click. Click is a normal finding. If you feel a click, you have to feel the head of the femur going into the acetabulum. As you can see it here, again, it's not usually that obvious, but what you're looking for is that feeling that the head of the femur is going to the acetabulum. See, I'm now holding the leg, abducting, pushing with these fingers anteriorly, and if you see here, the hip went into the acetabulum. Again, abduction, pushing anteriorly, and it went now into the acetabulum. This is another video showing a positive Ortolani test. If you see here, I'm holding the child. As we said, the knee is in the palm, the thumb is on the medial aspect, the lateral forefingers are on the lateral aspect. You hold both legs, but you do the test on one side only. So here it is. I'm holding the leg, doing first the Barlow test, and then I'm doing the Ortolani. So I'm abducting and then pushing with these four fingers, pushing the leg anteriorly. And if you see here, when I abduct, you see that you can feel that the head is going into the acetabulum. It was dislocated. Yes, you can. I'm going to repeat that part. It was head dislocated, and then with abduction, here it is. It went inside the acetabulum. So this maneuver, the positive result, as we said, is a clunk, and it's not a click. Here it is, and you will feel it if you do the test many times. And then if you have a child with a dislocated hip and you do it correctly, you will feel the clunk sensation. Thank you very much. All my videos are for educational purpose only. Please consult your doctor before any decision. Thank you.